తమ్ముడు సార్ 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 కెమెరా సార్ కెమెరా సార్ సార్ ఫోటో సార్ ఫోటో సార్ ఫోటో వచ్చిందా సార్
Raj, you can take off your shoes faster.
Come.
Thank you also for waiting. The lady like the lamp first. Thank you so much, Allah, what do you have to do? You are the
Smile. Bruce, can you start from here? Yes, we'll start from here. Those who are from
Morning, sir. Assistant supporting therapist.
So here there is no here. So when they see their at the in the presence of a physical therapist, this can be modulated as per the adjust your so augmenting the rehabilitation and faster recovery.
And holistic well-being for our elderly community. It now gives me great pleasure to invite someone who has been instrumental in bringing this vision to life. Dr. Rima, our co-founder, director and chief operating officer of KITES, has been at the forefront of shaping a care model that blends clinical expertise with deep empathy. Her commitment to redefining senior care and rehabilitation has been pivotal in conceptualizing this center. Dr. Rima, may I request you to kindly deliver the welcome address.
Good afternoon, everyone. Namaskara. Sorry for the little delay, but for all good things, we have to wait a little bit. I welcome our chief guest, Mr. Srinubabu, and our guest of honor, Dr. Sridhar, Dr. Srinivas, Raj, and all the media friends over here, invited guests. A warm welcome from all of you. Prakash Garu, thank you so much for coming. I think she has set the tone for the welcome today. We are all here together to celebrate this milestone for us. We definitely envision that we are going to be in the forefront of rehabilitation, creating a different healthcare vertical in healthcare. I mean, I stopped myself from saying our country because we can go global too. So we are here, and this is an evolution that we have done. We started here, we have now enhanced it with all our advanced equipment, the infrastructure, so that we are here. And this is our first Center for Advanced Geriatric Rehabilitation amongst all centers. This is the first one, and we thought that Hyderabad deserves that. The elders in Hyderabad, we are here to take care of them. See that they recover with dignity whenever they are unwell. It is just not about recovering them. It is about bringing back their functionality, bringing back their independence, giving them some purpose in life to look for tomorrow, that what I'm looking forward to tomorrow and doing something better. So these are all the, when a senior is 60, when they turn 60, they have good minimum 30 more years to go. 30 is a lifespan, and we work with the elders to ensure that this lifespan is active, it is purposeful, it is independent. So on behalf of all of us at KITES, thank you all so much for being here, and I warmly welcome you all for this particular milestone in our life. Thank you so much.
For beautifully sharing the insight behind this initiative. It is now my honor to introduce our chief guest for the evening, Srinubabu. A respected leader, Srinubabu Garu comes from a reputed family with a strong legacy in public service and politics. He is the son of the late Sri Judila Sripada Babu Garu, a highly regarded leader known for his integrity, dedication to public services, and deep connection with the people. Carrying forward the legacy, dedication, he currently serves as the General Secretary of the Telangana Pradesh Congress Committee. He is widely recognized for his commitment to public welfare and his consistent efforts in strengthening community-focused initiatives. His presence today adds immense value to this occasion, especially as we take a meaningful step towards enhancing healthcare infrastructure for seniors. May I now request Srinubabu Garu to kindly address the gathering.
Good evening, ladies and gentlemen, everybody, namaskaram. Andariki namaskaram. Munduga కావాలని కాదు. ఈ ప్రోగ్రామ్ ఎంత ఇంపార్టెంట్ అంటే నేను 300 కిలోమీటర్స్ నుంచి దీని గురించే వచ్చాను. సో డాక్టర్ సార్, మేకింగ్ యూ వెయిట్, ద మేనేజ్మెంట్ ఆఫ్ KITES, ద స్టాఫ్ ఆఫ్ KITES, అవర్ బాస్ Rima Garu and my good friend Rajgopal are very extremely sorry for that. One of the reasons why I have agreed, I don't think I am still achieved to be a chief guest, but one of the reasons is I am associated with them for their cause, for their vision. Today, opening of this, I mean, we talk about everybody, doctors are there, the rehab centers are there, they will talk about health, they will talk about medicines, they will talk about routines, they will talk about rehab, they will talk about all other things that are related to health. But I don't want to talk about it. I'm not a doctor. But what makes it different is there are few things that make things different. And that is, if you look at today's life, parents and grandparents, they feel abandoned for various reasons. And children feel disconnected because they want to do but not able to do. One of the reasons can be far away from city, far away from another country, sons, son-in-laws, wives, daughter-in-laws. There are multiple factors that do not allow for them to do what they want to do. Because nobody wants to disrespect their parents, not to do disservice to their parents. But what happens is today's community, today's generations, and today's pressures, work pressures you call it, for me they are all excuses. But in terms of that, what truly does this is today, as she said, dignity. Ma'am, I want to add few more things. We are not opening a center today, and I mean it from the heart. We are opening a center for care, a center for humanity. And the biggest thing that makes it different is KITES. KITES is the one that is bridging the connections between sons and the parents, sons and the grandparents, grandsons and grandparents. Literally bridging the gap between the families. And I have seen it. And why I am telling you this is I am associated with them in senior living. And I'll tell you why. I have two kids. One is a teenager and one is a tween. And I am proud to say I stay with my mom. My mom does not stay with me. And I'll tell you the reason. Doctors, healthcare, they will all talk about it. But I'll tell you, today, as you rightly said, 60 is the new 40, and they have at least 30 years to live. But if the same senior citizens are connected, if they are connected, if they feel secure, if they feel connected with their sons, parents, kids, siblings, anybody, their life to grow, their life to live, is so much more. While medicine can cure physically, I think today's senior citizens' lives are dependent not just on physical healthcare, but more on emotional stress that they are going through. And this is my view. So, why I am here, what for I am here, and the purpose for this is, if you look at what they are doing, is nothing short of a philanthropic act. And I am very proud to be associated with them in other ventures. And in this world, I'll tell you a few examples. People staying in US. Now, what happens with this? They want to do something, but they are not physically present. But a institution like do not feel very secure that there is somebody to take care. The same parents now feel taken care. The same kids who are disconnected now can say they can live, at least sleep peacefully, that they are contributing to their parents' well-being. So the biggest thing that we are doing beyond, KITES is doing beyond medicine, beyond anything, is the greatest humanity act of connecting the families together as a bridge. And I'm very proud, I'm so glad, and I mean it from the bottom of my heart, not because I'm the chief guest, but coming from a public service, on a day-to-day basis, I meet about 20,000 people on some days. And what I feel, where the problems and everything is in the family. And especially in the senior citizens, they feel, all the parents, they give selflessly, unconditional love. And as they grow older, they feel shy to even tell their kids. They don't want to be dependent. They don't want to be anything. And they become recluse. And what happens with this is, the sons with their pressures and so on also keep, I don't want to say neglecting, but busy in their own lives. And this creates a huge gap. And a facility like this, we are going to open, they are going to open a senior living, and we are going to talk more about them there. But today, opening a geriatric center for rehab, this is going to change the lives of many seniors, what I have seen here. And I told Dr. Rima just now that it's not just for seniors. Lazy people like me also can come and get some treatments sometimes. So, in fact, I again tell it that we are not opening a center today. We are opening a place for dignity, we are opening a place for care, we are opening a place for humanity. And our COO promised, I talked to her, she said, this will be a place for excellency, with warmth, with grace, with lot of love and affection. Anybody who comes here will go with their heart filled. And the people who are going to be the custodians for their parents will also sleep peacefully. So in fact, I thank you for inviting me, giving me an opportunity to address, because not many people talk about beyond healthcare. Not many people can get emotionally connected. And we are living in a place where emotions have lost. It has become a transactional world. But at the end of the day, it is emotions that matter. It is emotions that lead to success. And it is emotions that keeps family together. And that's what I think is success. Is the key to success and happiness in the family. Thank you once again. Thank you, Rajagopal Garu. I once again apologize for coming a little late. My apologies.
For the wonderful speech. I now introduce our guest of honor, Dr. A. Srinivas Kumar. Dr. Kumar is a highly esteemed cardiologist and currently serves as the Director of Cardiology at Apollo Hospitals, Hyderabad. With decades of experience and a deep commitment to patient care, he has been instrumental in advancing cardiac healthcare and mentoring the next generation of medical professionals. His insights into this integrated care are invaluable, especially in the context of geriatric rehabilitation. Doctor, we are delighted to have you here. May I request you to please share your thoughts, please.
రాజగోపాల్ గారికి, రీమా గారికి, హాస్పిటల్ KITES మేనేజ్మెంట్కు ఆపర్చునిటీ ఇచ్చినందుకు చాలా చాలా ధన్యవాదాలు. మీరందరూ ప్రెస్ మీడియా మిత్రులు ఇందులో ఏం జరుగుతుంది, ఫర్దర్గా ఎట్లాంటి ట్రీట్మెంట్ ఇస్తాయని మీ ఉత్సుకతతో ఉండొచ్చు. కొన్ని మీకు చూపించారు ఆల్రెడీ. ఇప్పుడు ఏంటంటే సార్ మాట్లాడినట్టుగా సీనియర్స్కి తెలుగులో మాట్లాడాలి, ఇంగ్లీష్లో మాట్లాడాలి. తెలుగు ఇస్ బెటర్ బికాజ్ అయితే యూ. సో ఇంతకుముందు ఏంటంటే సార్ చెప్పినట్టుగా ఎల్డర్లీ పీపుల్, సీనియర్స్, ఏం జబ్బు లేని వాళ్ళకు కూడా అప్పుడప్పుడు సీనియర్ లివింగ్ అని కడుతున్నారు. అదంతా ఉన్నది. కానీ ఇక్కడ ప్రత్యేకంగా KITES ఫెసిలిటీలో ఏంటంటే ఏదైనా పేషెంట్కి మీకు పెరాలసిస్ వచ్చింది అనుకోండి, కాళ్ళు చేతులు పడిపోయినాయి అనుకోండి, చాలా రోజులు దానికి రికవరీకి టైం పడుతుంది. అన్ని రోజులు హాస్పిటల్లో ఉండలేరు. అలాగనే పేషెంట్కి ఏదైనా కాంప్లెక్స్ హార్ట్ ఆపరేషన్ అయిందనుకోండి, రికవరీకి చాలా టైం పట్టవచ్చు. అన్ని రోజులు కూడా హాస్పిటల్ ఎక్స్పెన్సివ్ ఉంటాయి, అన్ని రోజులు పెట్టుకోలేరు. అదే కాకుండా కొన్ని రకాల జబ్బులకి చాలా ఈ ఎక్సర్సైజ్లే ట్రీట్మెంట్గా ఉంటాయి. అట్లాంటివి అన్నిటికీ కొందరికి ఎల్డర్లీ పీపుల్లో బ్రెయిన్ కెపాసిటీ తగ్గి మర్చిపోతుంటారు. అట్లాంటి వాళ్ళకి దానికి సంబంధించిన మల్టిపుల్గా క్రానిక్గా ఉండే ప్రాబ్లమ్స్ కంటే ఒక హార్ట్ అటాక్ వచ్చినప్పుడు ఒక వారం రోజులు ట్రీట్మెంట్ చేయడమే కాదు, దాని తర్వాత హార్ట్ వీక్ అయిపోయి ఫెయిల్యూర్ అయినప్పుడు చాలా రోజులు రికవరీ టైం పట్టినప్పుడు అట్లాంటి కండిషన్స్ అన్నిటికి కూడా దీన్ని ట్రాన్సిషనల్ కేర్ అని, దాని తర్వాత మెయిన్ హాస్పిటల్ నుంచి డైరెక్ట్గా ఇంటికి పోయే ముందు కూడా మధ్యలో అట్లాంటి ఫెసిలిటీస్ కూడా ఇక్కడ క్రియేట్ చేస్తారు. అదే కాకుండా ఎవరైనా ఇప్పుడు సార్ చెప్పినట్టుగా పేరెంట్స్ పిల్లలు బయట ఉన్నా అట్లా వాళ్ళకి కేర్ తీసుకుంటూ లేకపోయినా అట్లాంటి వాళ్ళని కూడా పెడతారు. ఇంకోటి నేను గమనించింది ఏంటంటే ఈ కైట్స్ మేనేజ్మెంట్ చాలా థ్యాంక్స్ చెప్పాలి. అన్ని ఫెసిలిటీస్ క్రియేట్ చేసి కూడా ఆత్మీయతతోని అందగంతో అన్ని పంచుతున్నారు, కానీ పేషెంట్ ప్రైసింగ్ అంతా చాలా రీజనబుల్గా పెట్టారు. డీటెయిల్స్ అని వాళ్ళు చెప్తారు. దట్ ఐ డోంట్ నో హౌ విల్ ది ఏబుల్ టు మేనేజ్ సో మచ్ గుడ్ ఫెసిలిటీ విత్ సచ్ లెస్ చార్జెస్. ఇట్స్ క్వైట్ అప్రిషియబుల్. ఎందుకంటే మళ్ళీ ఇది కూడా సేమ్ హాస్పిటల్ లాగా ఛార్జ్ అవుతుంటే కష్టం అనే సదుద్దేశంతో అన్ని కలిపి రాజగోపాల్ గారు మేడం చేస్తున్నారు. ఇది చాలా అభినందనీయం. చాలా మందికి తెలియదు కూడా ఇట్లాంటి ఫెసిలిటీ ఒకటి ఉన్నదని. దో అవేర్నెస్ పెరుగుతుంది ఇప్పుడిప్పుడే, కానీ ఇట్లాంటి మీడియా మిత్రులందరినీ పిలిచింది ఎందుకంటే ఇట్లాంటి ఒక ఎక్స్పర్ట్ ఫెసిలిటీస్ ఉన్న కేర్ యాక్చువల్లీ శ్రీనగర్ కాలనీ లాంటి ప్లేస్లో ఇట్లాంటి చేయడం అంటే చాలా ఎక్స్పెన్సెస్తో కూడుకున్న పని. అయినా కూడా వాళ్ళు సదుద్దేశంతో అందరికీ అందుబాటులో ఉంచాలనే ఉద్దేశంతో చేస్తున్నారు. ఇట్లాంటి ఫర్దర్గా కూడా మన పాపులేషన్ ఎక్కువగా జీవిస్తున్నారు. లైఫ్ ఇంతకుముందు ఇండిపెండెన్స్ వచ్చినప్పుడు 50 ఏళ్ళు 60 ఏళ్ళకే చనిపోయేవాళ్ళు, ఇప్పుడు అది ఎక్స్టెండ్ అయ్యి 70 ఏళ్ళు అయింది. ఫ్యూచర్లో ఇంకా పెరుగుతుంది. సో ఇట్లాంటి ఫెసిలిటీస్కి ఎక్కువ ఇంకా అవకాశం ఉంది. అందుకే చాలా కొత్త ఫెసిలిటీస్ కూడా వస్తున్నాయి. కానీ అట్లా ట్రీట్మెంట్తో పాటు ఇలాంటి మన ఆత్మీయ స్పర్శతోని మన పిల్లలు అయితే కేర్ తీసుకుంటారో అట్లాంటి వాళ్ళని పెట్టి స్టాఫ్ను అట్లాంటి వాళ్ళని ఒకచోట చేర్చి ఇట్లా అన్ని మంచి ఫెసిలిటీస్ క్రియేట్ చేసి ఇలాంటి కైట్ సెంటర్ను ఇవాళ మళ్ళీ మాడిఫై చేసి శ్రీనివాస్ గారితో ఇనాగ్రేట్ చేయించినందుకు అది వీరందరికీ కూడా ధన్యవాదాలు. ఈ అవకాశాన్ని మాకు ఇచ్చినందుకు చాలా సంతోషం. హార్ట్ పరంగా అయితే ఏదైనా క్రానిక్ చెకప్స్ ఉన్నా, అట్లా ఏమైనా ఫర్దర్గా ప్రాబ్లమ్స్ ఉన్నా, బీపీ ఉన్నా, షుగర్లు ఉన్నా, హార్ట్ అటాక్ అయినాక రిహాబిలిటేషన్ ఉన్నా, బైపాస్ సర్జరీ అయిన తర్వాత రిహాబిలిటేషన్ ఉన్నా, మాకు తోచిన అడ్వైజులు ఏమైనా కావాలంటే మేము అందించడానికి ఎప్పుడైనా రెడీ ఉంటామని చెప్తూ ఈ అవకాశానికి ధన్యవాదాలు తెలుసుకుంటూ థ్యాంక్ యూ.
Valuable insights. I am now honored to introduce our next guest of honor, Dr. Sridhar Lingam. Dr. Lingam is the head of Department of Surgery at the Apollo Institute of Medical Sciences and Research, Hyderabad. A reputed surgeon and academician, he brings with him extensive expertise and a passion for clinical excellence. His contributions to surgical care and medical education have made a lasting impact in the healthcare community. Doctor, it's a privilege to have you with us today. May I please invite you to address the audience.
నమస్కారం. రాజగోపాల్ గారు నాకు లాస్ట్ 15 years నుంచి తెలుసు. సో వెన్ ఐ మెట్ హిమ్, we were associated in a hospital. Later he started this rehab. సో ఫస్ట్ సార్ 10 years 2015-16లో ఫస్ట్ సెంటర్ స్టార్ట్ చేసినప్పుడు he started it in one 2-bedroom house, 3-bedroom house. So he invited me, he asked me to visit that place. అది చూసినప్పుడు నాకు ఏదో సర్ప్రైజ్, ఏం చేస్తున్నాడు సారు, మేమంతా అప్పుడు పక్కా హాస్పిటల్ బిజినెస్లో ఉండేవాళ్ళం, ఏం చేస్తున్నాడు సారు అంటున్నారు. సో నౌ హీ గ్రూ అప్ టు సచ్ లెవెల్. నౌ ఆల్ యూ కెన్ సీ, నౌ దే హ్యావ్ సెంటర్స్ ఇన్ 8 cities of India, and in Bangalore itself they have 3 centers, and he is doing wonderful job. సో కొన్ని సర్ప్రైజింగ్ విషయాలు మాకు యాజ్ ఎ క్లినిషియన్ చాలా విషయాలు తెలుసు, కానీ బెంగళూరు సెంటర్లో పోయినప్పుడు ఐ వాజ్ సర్ప్రైజ్ టు నో ద ఫెసిలిటీస్, వాట్ కైండ్ ఆఫ్ ఫెసిలిటీస్ దే ఆర్ ఆఫరింగ్. సో మోస్ట్ ఆఫ్ దెమ్ ఆర్ టోల్డ్ బై అవర్ ఫ్రెండ్స్, బట్ 1 or 2 things what surprised me was it was more like a geriatric crush. సో ఇంట్లో ఎవరు లేరు, ఫాదర్ మాతంతో ఉంటాడు, బట్ హీ కాంట్ లీవ్ ఫాదర్ at home while going to office. They used to leave them here and pick up them while going home back. So this was a surprising facility. And another thing, and one patient was with them, dementia patient, I believe. So on and off, weekly once, their children, they used to come and spend time with them. They had that kind of all facilities. So I think this is the most happening thing. I mean, because as already our friends have told, 30 years lifespan perigindi kabatti, there is a need for this. I think this is going to grow exponentially, and I wish all the best to Rajgopal and Dr. Reema. Thank you. Thank you for giving me this opportunity.
As we come to the close of this wonderful evening, it is my privilege to invite someone whose vision and leadership have been instrumental in shaping KITES. Mr. Rajagopal, co-founder, director and CEO of KITES, has been a driving force behind building a care ecosystem that truly prioritizes dignity, compassion and clinical excellence for seniors. Sir, I request you to kindly deliver the vote of thanks.
Everybody, I won't take long. First of all, thank you so much to our press friends. I know you have been waiting for long. I think good things are worth waiting because Anna was stuck in his village with some other issue. I know what it is. He's always hounded by people for help and he's somebody who will not say no to help. So I want to sincerely thank you all on his behalf. Of course, you all know him better than all of us. I think whatever we have achieved so far is basically because of a great team that we have. I think in Hyderabad, I think Harika and Dinesh, I think all of you have done a fabulous job. Thank you all so much. I should now thank our esteemed landowner here. They are here present with us. Thank you so much, sir, for your support. Prakash Garu, thank you so much for being here with us all the time. I just want to take 2 minutes. Dr. Srinivas and Dr. Sridhar are very, very established and reputed people in their field. I like them for only one reason, because they're absolutely ethical and want to deliver the right kind of care for people, and they work with one of the finest brand, Apollo. All of us grew up learning from brands like Apollo. And I think whatever we do, I think we take their views, and thank you so much for being a great support to us and guide to us. We'll keep leaning on you. These establishments are what we call a step-down hospital. So it is where people get better, get out of the hospital, but they need further care for another 2 weeks, 4 weeks, 8 weeks. Where will they go? That is where they come to us. And that is where people like Dr. Srinivas and Dr. Sridhar have a large role to play in counseling people for appropriate care, because this kind of care makes sure that people don't go for readmission and their care is better, so that Dr. Srinivas people can deliver better care for more people actually. So I think thank you so much, Dr. Srinivas, for coming, and Dr. Sridhar being always supportive to us. Of course, before I wind up, I cannot thank much our esteemed guest, Srinubabu. I just want you all to know that we have been friends, but I think what I really like about him and Anaya also and your entire family is, I think they are very well known for dedicating themselves to the cause of the welfare of people. I want you all to know, Hyderabad, Telangana is one government which has been very proactive in geriatric care, announcing a lot of recent schemes for taking geriatric care to the rural government, which you should talk to Anna, and Anaya is also there in that whole thing. So I'm part of a larger association body in India, and we track a lot of governments and what they do. I wanted to know, Telangana government has taken a wonderful step of setting up these regional clinics in the rural markets for helping geriatric population. So thank you so much for you and your government for having taken that step forward. Whenever I talk to Shinu Anna, I think I've always been encouraged. I think what do you want from government? What support do you? We have not taken any support from them. But the moral support from the government to say that you all can do good in Hyderabad and other parts of Telangana itself is very encouraging. And one thing which moved me today from what he said is, my mother is not living with me. I am living with my mother. You know, the family culture is something that gets translated to a lot of people. We have a lot of things to learn from them. So thank you so much for taking your time, coming and blessing us. It means a lot to us. And we want to do more in Telangana, and we want to grow. And we need blessings from people like all of you. And before I wind up, I want to thank Dr. Reema, my partner, a thoroughbred medical professional who embodies the values of making sure that we deliver the right care for the family at the right price, doctor, and make sure that if our own people go stay there, what do we do? So we are also learning. This is a very new business, vertical in India itself. Out of hospital care is a growing business in India. When I say business, to be delivered in a manner that people can use it and benefit out of that. So media plays a very important role. Thank you all so much for coming. I think this kind of propagation will help not only us, but many other brands which are trying to grow in this field, because this is where we come to support great hospitals like Apollo's and others. They cannot take care of everybody all the time. They are there to take care of the acute episode and whatever important things to be done. Once they are out of the place, how do people like us come and help the patients? We are on the journey and we need all your blessings. Today is yet another great milestone. I once again thank all my team members and thank you all for having taken your time. Thank you. Thank you all. Thank you. Thank you. Thank you. Thank you so much.
I'm part of KITES, sir. I'm not a guest.
One minute. Give it.
Watch. Sir, yes.
Thank you so much.
Sir, okay.
Come to
Sir, one, yes. Okay, sir, thank you.
Thank you.